As we brave the realities of life, they never seem to tire in being shining beacons of wisdom, strength, and stability. Their love is a blessing that knows no boundaries. After all, they have walked farther, loved harder, and seen so much more of the world than we do. Make their day extra special, safely and conveniently by ordering through our takeout and delivery, drop by curbside pickup service, or through our personal shopper platform Get All Services. In the midst of these uncertain times, we must not neglect the important people in our lives, especially our beloved grandparents. Thank you for keeping our hearts full of love and joy. As long as you live, may it be in our hearts. Let us celebrate a timeless love.
Sino ang totoong poprotekta? Sino ang tunay na susuporta? At sino ang mag-aalaga? Ngayon, marami nang walang kasiguraduhan. Ngunit may sagot dyan na mapagkakatiwalaan. Kasino ang totoong poprotekta? Kasino ang tunay na susuporta? Kasino ang mag-aalaga? Kasino ang mag-aalaga laban sa germs and viruses? Kasino ethyl alcohol? Kasino ang mag-aalaga?
As we brave the realities of life, they never seem to tire in being shining beacons of wisdom, strength, and stability. Their love is a blessing that knows no boundaries. After all, they have walked farther, loved harder, and seen so much more of the world than we do. Make their day extra special, safely and conveniently by ordering through our takeout and delivery, drop by curbside pickup service, or through our personal shopper platform Get All Services. In the midst of these uncertain times, we must not neglect the important people in our lives, especially our beloved grandparents. Thank you for keeping our hearts full of love and joy. As long as you live, may it be in our hearts. Let us celebrate a timeless love.
Sino ang totoong poprotekta? Sino ang tunay na susuporta? At sino ang mag-aalaga? Ngayon, marami nang walang kasiguraduhan. Ngunit may sagot dyan na mapagkakatiwalaan. Kasino ang totoong poprotekta? Kasino ang tunay na susuporta? Kasino ang mag-aalaga? Kasino ang mag-aalaga laban sa germs and viruses? Kasino ethyl alcohol? Kasino ang mag-aalaga?
Happy Grandparents' Day from Vista Diagnostics. I am Dr. Pamintuan, and today we will be having a short webinar on how to keep our elderly safe and healthy during this pandemic. So today I will be discussing the following. So for the top illnesses among the aging group in the Philippines, the most essential tests for adults, annual vaccination, caregiving for the elderly, and the VCare Diagnostics Program for supporting our senior citizens. So in this slide, it is shown that high blood pressure or mataas po na presyon counts as the top illness diagnosed among the aging group in the Philippines. And then for the next, the leading causes of mortality or death in the Philippines is ischemic heart disease. So paano po ba nagde-develop ang ischemic heart disease? So it develops when yung cholesterol po sa ating dugo ay nag-accumulate in the walls of the arteries of the heart. So yung nag-deposit po doon ng cholesterol, they narrow the arteries and then eventually nag-reduce po ang amount ng oxygen that supplies our heart muscle. So and then the second one is pneumonia. So ito po ay infection of the air sacs of the lungs. So it is caused by bacteria, viruses, or fungi. People na pinakamataas po ang risk na magkaroon po ng pneumonia include those over the age of 65 and the infants under the age of 2. So, yung weakening of their immune system makes them less able to fight these types of illnesses. And then for the third one, cerebrovascular diseases, ang kasama po doon ay stroke and aneurysm. And yung pang-apat naman po natin ay malignant neoplasm or cancers po. Ang most common po sa Philippines for women would be cancers of the breast, and then lung, liver, colorectal, and prostate cancer for men. Yung mga iba pong causes of death pa in the Philippines includes diabetes mellitus, respiratory diseases like asthma and emphysema, like for chronic smokers po yun, hypertension, and tuberculosis. And so the purpose po ng araw na ito is to honor our grandparents, di ba? And what better way for us to show our love for them by keeping them healthy? One of the best ways na matulungan po natin sila to prevent these types of illnesses na nasabi ko po is to have their annual health check-up without fail. So meaning po, dapat compliant po sila sa pagpupunta po sa doktor, follow-up, and compliance with their maintenance medications. Importante po ang thorough health assessment and laboratory workup is vital because many seniors tend to suffer from high blood pressure, diabetes, dyslipidemia, which is mataas po ang cholesterol nila, and then heart disease. So blood tests like comprehensive metabolic panel. Ang kasama po doon ay liver and function test, yung test po para sa thyroid, their cholesterol and sugar levels, complete blood count, 12-lead ECG which measures po yung pagtibok po ng ating puso kung normal pa po or hindi, chest x-ray which assesses our lungs, urinalysis are all important for our seniors' health evaluation. So pag na-detect po natin ang any abnormalities or derangement in their laboratory values, maiko-correct po natin ito agad. So when it comes po for screening for cancers for senior citizens, this should be done in consultation with the patient's primary care physician in order for the test to be decided in detail. So, iba-iba po kasi ito per senior citizen, hindi po siya pare-pareho. Depende po sa kanilang risk factor at iba't ibang comorbidities. So each individual should have their own assessment to attain the best possible health and performance para sa isa pong patient. But generally speaking, for men, the screening for prostate cancer starts with prostate-specific antigen testing, which is recommended for men aged 50 and above. While for the annual mammogram naman po, for breast cancer screening, it is recommended for ages 45 and above, depending on their family history and risk factor for breast cancer. So with age, our grandparents, they become much more susceptible to severe illnesses and infections. So that is why vaccines are another important health tool. So we have the influenza vaccine. It is recommended annually at the beginning of each flu season, as each year yung vaccine po na iyon is designed for the most common strain. And then being that yung pneumonia po is occurring any time of the year, the pneumococcal polysaccharide vaccine, effective po siya for the 23 most common strains of the bacteria that may cause severe respiratory complications. So, and of course, any type of COVID-19 vaccine available near you is also important for protecting you against severe disease and death from any variant of the virus. So now we know that complete immunization and vaccination of our grandparents makes a fairly significant difference in their well-being. So for caregiving for our elderly, they should keep themselves healthy and active by doing mild to moderate daily exercises. So mag-practice pa rin po ng physical distancing but not social isolation by using technology or social media so they can stay connected with their loved ones even on social isolation. To minimize the risk of COVID-19 infection by frequent hand washing and disinfecting by using casino ethyl alcohol. So this is made by 70% ethyl alcohol that disinfects without drying skin even with everyday use. So this is available at your all-day supermarket and all-grain stores nationwide. And then we can also postpone non-emergent doctor visits by using telemedicine instead. So, and try to stock up on your maintenance medications to lessen your travel exposure. So here in VCare Diagnostics, we have a special promo for our seniors for this upcoming Grandparents' Day. Contact us at the number flashed on the screen or visit us at the lower ground floor of Somo A Vista Mall, Danghari. Once again, happy Grandparents' Day and I hope to see you soon at the clinic. Thank you.
We all know normal has changed. Going out and about simply isn't what used to be. But even in the new normal, we know some things won't change. We still smile. We still share. We still care. We still celebrate. We still love. ECQ, MECQ, GCQ, or for whatever Q comes after it. We'll be right here. And that's something that won't change.
As we brave the realities of life, they never seem to tire in being shining beacons of wisdom, strength, and stability. Their love is a blessing that knows no boundaries. After all, they have walked farther, loved harder, and seen so much more of the world than we do. Make their day extra special, safely and conveniently, by ordering through our takeout and delivery, drop by curbside pickup service, or through our personal shopper platform, Get All Services. In the midst of these uncertain times, we must not neglect the important people in our lives, especially our beloved grandparents. Thank you for keeping our hearts full of love and joy. As long as you live, may it be in our hearts. Let us celebrate a timeless love.
Sino ang totoong poprotekta? Sino ang tunay na susuporta? At sino ang mag-aalaga? Ngayon, marami nang walang kasiguraduhan. Ngunit may sagot dyan na mapagkakatiwalaan. Kasino ang totoong poprotekta? Kasino ang tunay na susuporta? Kasino ang mag-aalaga? Kasino ang mag-aalaga laban sa germs and viruses? Kasino ethyl alcohol? Kasino ang mag-aalaga?
Good day everyone, and happy Grandparents' Day to all of our lolos and lolas out there. I'm Ria Jarete Esperanza Shapno, a registered nurse by profession, and I'm the Clinic and Program Management Head of VCare Diagnostics. I would like to share an information to all of our viewers out there on how telemedicine helps us during this pandemic. So to start with, let me give you the meaning of telemedicine. Telemedicine is defined by WHO as by all healthcare professionals using informations and communication technologies all in the interest of advancing the health of individuals and their communities. Telemedicine involves the use of electronic gadgets for communication. It includes two-way video using your smartphones and other wireless tools that help our patient connect to physician regardless of their physical and geographic location. So what happened during the COVID-19 pandemic? So it has changed many things, including how you visit the doctors. So especially during the second quarter of 2020, wherein even the OPD or outpatient consultation has been limited. So in the past, doctors here in the Philippines were reluctant in using telemedicine consultation because of the limitation of diagnosis without conducting physical examination. But during this pandemic, telemedicine became a technology of a great importance. So I will be providing you the benefits of the telemedicine, or the benefits of the patients using the telemedicine. So using telemedicine as alternative to in-person visit has a host of benefits for patients and providers alike. So patients enjoy less time away from work, no travel expense or time, less interference with child's or elder care responsibility, privacy, and lastly, and very important, is that no exposure to other potential contagious patients. So how telemedicines work? There are two ways of the telemedicine. So one is the patient portal, wherein if you will be contacting your primary care clinics, they will be providing you like a patient portal. So that patient portal includes or has your medical records. You just have to send emails to your doctors, and then your doctors can provide you a prescription refills or set up an appointment. That is a patient portal. The next one would be the virtual appointment. So this is where the patient and the doctors will have an appointment through a video or a phone call conference. So how can we prepare ourselves during the telemedicine? So first, you need to contact your HMO. So every HMO has their own preferred telemedicine clinic. So you need to contact them and have your LOA prepared. Next thing to do is write down your symptoms and pre-existing conditions. So all of your symptoms and pre-existing conditions should be disclosed during your doctor consultation with you. So if you have your blood pressure readings, temperature, pulse rate, so those information are also important for the doctor to provide you an accurate diagnosis. So you should take note of that as well. The third one would be prepare your question. So you might forget your question, so you better take down notes of it so you never missed any. And then the next would be prepare your gadgets and spot for telemedicine. So your gadget like cell phones, laptops, headset with microphones, and especially the internet should be tested before the telemedicine consultation. So you need to check also the spot or the place that you will be using during your telemedicine. So there would be no distractions and for you to have a successful telemedicine visit. Lastly, be ready for any face-to-face follow-up appointment that will be suggested or recommended by your physician. So please take note that telemedicine also has its limitations. So it can never replace a face-to-face visit with your doctor. So with my next slide, it will be showing you a short list of common conditions that may treat via telemedicine. So here are the list. It includes like allergies, arthritic pain, asthma, bronchitis, colds and flu, diarrhea, pharyngitis, conjunctivitis or sore eyes, even those symptoms that are showing to those patients with COVID, not including the difficulty of breathing. Okay. So again, telemedicine can do many things, but it can't replace all doctors' visit. You should take note of that. And the good thing is that here in VCare Diagnostics, also offer telemedicines to all of our patients, and we got the easiest telemedicine consultation that even our grandparents can easily navigate or use. So I will be showing with you what are those steps. So you just have to contact us, contact the number of our telemedicine hotline, and then there would be a telemedicine operator that will be providing you the doctor's schedule. They will be taking down all your informations, and then from there you can settle the payment. After that, our telemedicine operator will be sending you the link that you just have to click, and it will be automatically connect to our telemedicine provider. So it's just as easy as clicking down or clicking the link that we will be providing you. So we also offer our telemedicine e-card. So it includes, or it will be providing you a 1-year unlimited telemedicine consultation with our physician, but also provide you a 10% discounts with other services. So you just have to call us, and then we will be providing you an information on how to get this telemedicine e-card. So if you have any health concerns or health services that you'll be needing, so you just have to contact us here at VCare Diagnostics, located at SOMO A Vista ground floor, and experience the safest clinic here at the South. So thank you everyone for watching, and be safe. Thank you.
The realities of life, they never seem to tire in being shining beacons of wisdom, strength, and stability. Their love is a blessing that knows no boundaries. After all, they have walked farther, loved harder, and seen so much more of the world than we do. Make their day extra special, safely and conveniently, by ordering through our takeout and delivery, drop by curbside pickup service, or through our personal shopper platform, Get All Services. In the midst of these uncertain times, we must not neglect the important people in our lives, especially our beloved grandparents. Thank you for keeping our hearts full of love and joy. As long as you live, may it be in our hearts. Let us celebrate a timeless love.